Most people think medical students have photographic memory. They imagine some genius sitting in a library, flipping through a textbook once, and suddenly remembering every nerve, every drug, every Latin term. But most of medical students are completely average. Same brain as you, same 3-pound blob of fat inside the skull. Yet somehow, they memorize 10,000 medical terms, drug names, anatomy, diseases, symptoms, pathways, all of it, without a photographic memory. So what's going on? How does an ordinary brain store that much information without exploding? The answer is uncomfortable. Medical students aren't smarter. They just use a learning system the rest of the world never learns. A system built inside hospitals, inside residency programs, inside surgical training. And once you understand it, you realize something terrifying. You could learn 10 times faster too. I'm about to show you exactly how they do it. And by the end of this video, you'll never study the same way again. Chapter 1. They don't memorize terms. They compress them. Most people study medical terminology like this. They see a giant list. Hypertension, hypoglycemia, bradycardia, tachycardia, encephalopathy, nephrolithiasis, thousands of random words. And they try to memorize them individually. This is the fastest way to destroy your brain. Why? Because working memory is tiny. Psychologist George Miller discovered something called the magical number 7. Your brain can only hold about 7 items at once. 7, not 70, not 700. 7. Now imagine trying to memorize 10,000 medical terms one by one. Impossible. But here's what medical students do differently. They don't memorize words. They memorize patterns. This technique is called chunking. Cognitive scientist Herbert Simon studied chess masters and found something shocking. Grandmasters don't memorize thousands of individual chess moves. They memorize patterns of pieces. The same thing happens in medicine. A beginner sees confusion, fruity breath, rapid breathing, high blood sugar. 4 separate facts, hard to remember. A doctor sees diabetic ketoacidosis, 1 pattern, 1 chunk. Suddenly, 4 facts become 1 idea. Memory load collapses. Thousands of symptoms compress into a few hundred illness scripts. It's like zip filing data. You're carrying loose groceries, they're using bags. Medical school teaches you to compress information into disease scripts. Symptoms, mechanism, treatment, outcome. Instead of remembering 30 facts, you remember 1 story. But here's the problem though. Compression alone won't save you. You can understand something perfectly and still forget it tomorrow. That's where the second system comes in. Chapter 2. They turn studying into interrogation. Most people study passively. They read, highlight, reread. Highlight again, feels productive, feels smart, completely useless. Psychologists call this the illusion of competence. You recognize the information, so you think you know it. But recognition is not memory. It's familiarity. Big difference. Researchers Roediger and Karpika proved this in a famous experiment. 2 groups of students studied the same text. Group 1 reread the material repeatedly. Group 2 did something different. They tested themselves. No notes, just questions. Guess what happened? The testing group remembered 50% more information days later. Why? Because retrieval is the workout. Reading is just looking at the gym. Medical students live inside this principle. In hospitals, there's a brutal tradition called pimping. A senior doctor walks down the hallway, stops a student, then asks something terrifying. What artery supplies the pancreas? What is the mechanism of warfarin? What are the causes of hypercalcemia? No warning, no preparation. You answer immediately, or you fail publicly. Sounds cruel, but it works, because the brain remembers stressful retrieval. When you struggle to recall something, your brain releases neurochemicals that strengthen memory. Mistakes become sticky. Robert Bjork calls this desirable difficulty. Learning should feel uncomfortable. If studying feels easy, you're probably not learning. Medical students test themselves constantly. Practice questions, flashcards, clinical quizzes, oral exams, thousands of micro-interrogations. Every day, they don't read notes. They attack their own brain. But here's the thing though, even active recall isn't enough, because memory is leaking constantly. Information disappears over time. Fast, brutally fast. Which brings us to the third system. Before we continue, hit subscribe before you forget. This channel exists for one reason: fixing broken learning systems. We fix leaks here. Now let's continue. Chapter 3. They hack the forgetting curve. In 1885, a German psychologist named Hermann Ebbinghaus discovered something terrifying. Your brain forgets almost everything. The graph is called the forgetting curve. Here's what it looks like. After one day, you forget about 50% of what you learned. After 1 week, almost 90% is gone. Gone, deleted, like it never existed. So if medical students tried to memorize thousands of terms normally, they'd lose them all within weeks. But they don't, because they use an algorithm. It's called spaced repetition. Instead of reviewing randomly, the system shows information right before you forget it. Not too early, not too late, exactly on the edge of forgetting. Every successful recall strengthens the memory. The interval grows longer. 1 day, 3 days, 1 week, 1 month, 6 months. Eventually, the memory becomes permanent. Medical students use software for this. Most famously, Anki. Thousands of flashcards, automatically scheduled by the forgetting curve. You review cards while waiting in line, walking to class, standing in the elevator. 5 minutes here, 10 minutes there. Tiny learning sessions, every day. And the algorithm does the timing. You don't think about it. The system thinks for you. Over time, something incredible happens. Thousands of facts become permanent memory, not through cramming, but through timing. But here's the problem, though. Even spaced repetition doesn't explain everything. Because medicine isn't just about remembering facts. It's about recognizing patterns instantly. And that's where the final advantage appears. Chapter 4. They train their brain like pattern recognition software. When a beginner sees a patient, they see chaos, headache, fatigue, fever, nausea, 10 random symptoms. Confusing. A doctor sees something different, a pattern. Doctors don't memorize diseases. They recognize illness scripts. Cognitive scientist Patricia Benner studied how doctors develop expertise. Her conclusion was surprising. Experts don't reason step by step. They recognize patterns instantly, like facial recognition. Think about how you recognize a friend's face. You don't analyze nose, eyes, jawline, hair. Your brain just says, oh, that's Sarah. Medical training builds the same system. Every patient becomes a case study. Symptoms, lab results, diagnosis, outcome. Thousands of cases accumulate. Eventually, the brain builds a massive pattern database, which means when a new patient appears, the brain runs pattern matching automatically. This is called clinical intuition, and it only emerges after massive exposure. Medical students accelerate this process. They study through case-based learning. Instead of memorizing facts, they study patient stories. Example, a 55-year-old man, chest pain, sweating, pain radiating to the left arm. Instant pattern, heart attack. Now dozens of isolated facts become one narrative. Stories encode deeper than lists. Emotion increases retention. Research in neuroscience shows emotional information activates the amygdala, which strengthens memory formation, which is why medical students remember cases better than textbooks. A dramatic patient story sticks. A list of symptoms doesn't. But here's the final twist. Even with all these systems, there is still one huge mistake most learners make. The real reason. Most people learn. Slowly. Most people try to learn everything. Every detail, every chapter, every slide. Medical students don't. They use something called high-yield filtering. In medicine, some facts appear constantly. Others almost never appear. Students learn to identify high-yield information, the crucial 20%, the patterns doctors see every day. This follows the Pareto principle. 80% of clinical decisions rely on about 20% of diseases, which means learning the right 20% gives enormous advantage. Instead of drowning in details, students focus on core mechanisms, core diseases, core treatments. Everything else becomes secondary. This dramatically reduces cognitive load, and suddenly learning thousands of terms becomes manageable. But here's the thing though, you don't need to be in medical school to use this system. You can apply it to anything. Languages, programming, finance, history, anything. Here's the simplified version. Step 1. Compress information into patterns. Step 2. Test yourself constantly. Step 3. Use spaced repetition. Step 4. Learn through cases and stories. Step 5. Focus on high-yield knowledge. Do this consistently. And something strange happens. Your brain stops feeling overwhelmed. Learning becomes mechanical, predictable, scalable. Exactly the way medical students learn. But there's still one problem. Even if you know all these techniques, most people never use them. Why? Because distraction destroys deep learning. Your phone, notifications, social media, constant dopamine. If your brain is addicted to distraction, None of these systems will work, which is why the next video matters. I break down the dopamine detox system that elite learners use to restore deep focus. It's the same system used by programmers, researchers, and top students. Once you see it, you'll realize why most people struggle to concentrate for even 5 minutes. Watch that video next. It might be the missing piece in your learning system.